Go ahead and get started for this morning's webinar. I want to welcome all of you. Thank you so much for being here this morning. My name is Carrie McClellan. I'm the Outreach Manager for ElderHelp. And I want to start by saying, I picked this topic prior to all of the community events taking place right now. I will be talking about the different care options for seniors, and I will mention some resources for those who are dealing with loved ones who might be concerned about the coronavirus. But I want to let you know that this webinar is not solely about the coronavirus. There is so much information coming out, and we're trying to do our best to provide resources, but this webinar is general information at this time. So I just want to be clear about that as we move forward. With that being said, I am definitely wishing you and all of your families all of the best during these times. It is not easy in our community, in any community right now. There's a lot of stress, there's a lot of worry and concern for our loved ones or for our clients. So this is definitely a difficult time. We're all in it together, I think, and we're doing what we can at ElderHelp and trying to connect people to valuable resources. As we move through today's webinar, I'm going to be sharing about general topics, but at the end I will provide some special links or resources that we found very helpful for our clients during this time. So I just want to let you know that and hope everyone is hanging in there. All right, so just a little bit about ElderHelp and our mission. So we provide personalized services and information to help seniors remain independent and live with dignity in their own home. So we really strive to help older adults continue to maintain that independence in their community where they want to be, where they're more familiar, and we work through all of our programs to help reduce social isolation, increase access to healthcare, and improve overall quality of life. Obviously, it's a little bit different right now. We're trying to modify how we do that so that we can staying in contact with our clients. So just a snapshot of our programs. We do offer information and referral, and I wanted to share that specifically because during this time we are helping people navigate the different resources that are available. So if you are looking for something specific, feel free to give us a call. It would be our main phone number. I'll share that at the end, and we'd be happy to try and guide you. Every day things are changing, so we're trying to stay up to date with all of that. We are also doing our Are You Okay check-in calls. So if you have a loved one who you think could benefit from having extra check-ins, maybe you're not able to do that on a daily basis. If we can help you with that, that's something that we are offering. And again, they would just need to contact our main phone number to get started with that process. For our current clients, we are modifying our services so that we are limiting as much personal in-person contact with our clients to help prevent the exposure to the coronavirus, but we are trying to help them with their essential needs at this time. So grocery shopping, medical appointments only, and medication. So that's kind of what we're doing for our current clients. This family caregiver webinar is part of our Employed Family Caregiver Support Program, and we offer a variety of webinar topics throughout the year, as well as we have 5 online courses that help family members walk through the process of being a family caregiver and what that looks like. And we have different assessment tools and resources available on those. So if you're interested in that, feel free to check out our website. All of that information can be found with links to connect you. And all of our programs are offered at no set fee. We have a donation-based model. Our family caregiving webinars and courses are all free. All right. So the objectives for today's webinar, I'm going to go through the different care options. I will include how to access these services and tips along the way for family caregivers through that process. So there's no doubt that it can be overwhelming when you're trying to figure out what services are going to be best for your loved one. There are so many different options available, which is a good thing, but it can be a challenge because trying to figure out where to start or what service might be the best can be a little bit difficult to navigate when you are exposed to so many different resources. So what we are going to talk about today are the differences, so hopefully you can have a better understanding of what the options are and maybe where it would be best to start with your loved one. We'll talk about all the variations so that you have that idea as well, but it can be overwhelming. We're going to take it one step at a time, and hopefully by the end you'll have a better idea of what's available. So this is just a brief rundown of what we're going to cover. So in terms of home care, we'll talk about in-home care agencies, in-home supportive services, which is also referred to as IHSS. I did also include adult day health care in this section, although it's not provided in the home. I wanted to mention it as an option as well. We will talk about home health care and what that means and what services are available, and then hospice care. So we'll go through all of those, and I've added in a few other things as well. So let's start with home care. So what is home care? So essentially home care is providing non-medical services to support individuals who are still living at home. That doesn't mean that home care can't be provided in other settings as well, but we're going to primarily focus on it being in the home. Home care is essential for people who are needing assistance with personal care, or in other terms, activities of daily living. So that could be bathing, dressing, toileting, feeding, meal preparation, those types of services. Those are essential to a person's survival. So that's what activities of daily living truly mean. In addition to that, though, home care can also offer companionship and other services for older adults or people of all ages who are looking for that type of assistance. So this gives a list. They can also help with like housekeeping, transportation or errands, medication reminders, and of course companionship or supervision. That can be very helpful for somebody who may have a decline in their cognitive state. So maybe they are a little bit more forgetful, or they're not as safe to be living at home alone, but family isn't available to be there. That's where a home care agency might be able to help out and provide that supervision and report back to the family. They are individuals who are caregivers. They're not medical providers, so they would not be able to administer medications, but they can certainly remind somebody that it's time to take their medications. In addition, there might be other services that you're looking for your loved one, and we'll probably cover more of that through the other services we're going to talk about today, which includes home health care, because home care caregivers are not able to provide medical treatment, so not any wound care or injections or things like that. So we'll cover that in another section. So the main topic a lot of times comes up, who pays for this service? So home care is often paid for out of pocket or private pay. The costs have increased drastically over the past few years. That is due to the new license requirement and the new minimum wage requirement. So there are a lot of changes that take place with home care. So the home care organizations or agencies are doing their best to provide the services to those who benefit from them and who need them. But they also have the employees to worry about and make sure that they are giving them the benefits that they deserve as well. So that's where the cost does increase, and over the years I've seen it increase quite a bit. So when I suggest a $25+ an hour, that's in general. There may be some that are a little bit lower, there may be some that are more. It's really just an average at this point. Other ways that this service could be paid for. If your loved one has a long-term care insurance policy, they may have a benefit that can help cover home care at home. And in order for that to come into play, they often do need to require assistance with a couple of the activities of daily living that we talked about. They may also need to pay out of pocket for a certain amount. There might be kind of a waiting period, whether it's 30 days, 60 or 90 days, that they would have to pay for the service out of pocket before the long-term care insurance would kick in. For anybody who does have questions about a policy that their loved one holds, I would encourage you to contact HICAP, which is Health Insurance Counseling and Advocacy Program, and they offer free, unbiased assistance for people who are wanting to know more about insurance options, but they can also help with deciphering what a long-term care insurance policy means and what the benefits are and maybe the criteria or eligibility for services. So I would encourage you to check in with them, and I can share that resource at the end if needed. The VA aid and attendance, so for those who have served in the military, they might have certain benefits depending on if they served a certain period of time during an actual war period. That would be something to look into. And then we also have for, hold on one second, we also have for the VA aid and attendance, not only for the veteran themselves, but also spouse of a veteran could benefit from that. So that's something to keep in mind there. We know that through the VA aid and attendance, they can help to offer support for paying for a home care agency, but it might also have a benefit for assisted living facilities. So if you're trying to weigh the options of staying at home or looking at alternate options, that would be a question to ask about to make sure that you are knowing all of the options available. Medi-Cal is another option for covering in-home supportive services, and for that benefit, we'll talk more about it in a couple of slides, but that is where you would have to qualify for Medi-Cal to have that benefit or be able to access it. In regards to the new license requirement that I mentioned, so that took place in 2016, and it is requiring that all home care agencies are now licensed. So there is a link that's on this slide. I will share it after the webinar as well when I send out the recorded version so that you have those resources. And I encourage you to check out the site that would be able to tell you what agency is licensed. There may be a few that are still operating out of license, so it's good to just check if you are in communication with a specific home care agency that you are checking that site to determine if they are actually licensed. What that means is that they have assured that they have background checked all of their caregivers and that they hold workers' compensation and that they have hired these caregivers as their own employees and have offered training to them. So there's a number of different criteria that they go through. So that would be something to make sure that you're keeping in mind with that. The page has changed a little bit over the years, so hopefully it's easier to navigate, but you would click on home care organization to access that information through the search function. So hiring a caregiver on your own or hiring a caregiver through an agency. We often hear that quite a bit where people are considering hiring a caregiver on their own and not going through an agency. So I do want to make sure that we're clear about the differences and the benefits. Obviously, hiring a caregiver on your own you may be able to hire somebody at a lower cost. So that could be where you're just paying them directly and they don't have the license fee that they're dealing with. So they might be able to offer their services at a lower rate. But keep in mind, if you are hiring a caregiver on your own, you then assume the responsibility of being their employer, which means you're responsible for any taxes or fees, workers' comp, insurance, unemployment, or any other benefits that they would have the right to as an employee. So that's something just to keep in mind. You might be able to find somebody through a friend or a neighbor or a church that you think would be a great fit, but just understand that there are laws about that, and if you are hiring somebody, you are being held responsible for those different benefits. The other thing that you should consider if you are thinking about hiring a caregiver on your own is what happens if they don't show up? What happens if they're sick or they're not able to come in? Do you have a backup plan in place? If your loved one isn't able to be at home alone and you're needing somebody to be there with them while you're at work, this could be an added stress if you're trying to find out another option if that one caregiver isn't able to come out. So by hiring a caregiving agency, yes, it does cost a little bit more, but the benefits are much greater. So by going through them, again, they would be assuming all of the different responsibilities, they would provide the training that's needed, and they can have backup caregivers in place. So that's just kind of weighing the options here. Everybody can make their own decisions, obviously, but it's helpful to have an idea of what that would look like. So how to select an agency. We definitely encourage interviewing a few different agencies to compare, get a feel for what their process is like, and have your questions ready so that you can ask those and find out who answers them and makes you feel more comfortable about that. It's important to take your time and really plan ahead. Obviously, this might not be possible if you're dealing with a new situation, if your loved one has had a recent change and you weren't prepared for it. That can be difficult to plan ahead. So I do want to make sure that you are knowing, take your time as much as possible, but understanding that that might not always be an option. So consider asking the following questions. Are your caregivers licensed and bonded? How quickly could you find a replacement if the caregiver is sick? Ask about billing. Is there an hourly minimum? Find out what other services that agency provides. Oftentimes, home care agencies might also have a home health arm, or they might also help with care placement if you're looking at other options. So maybe they help with in the home right now, home care, but at some point you might look for moving your loved one into another living environment. And at that point, that agency may be able to assist with that. So just asking those questions. And what is the matching process? You want to make sure that your loved one has a good fit so that they are on board with it and they're interested in having that help and they're feeling confident in that decision. So all of those questions could be helpful in you making that decision. All right, we're going to move to in-home supportive services. So again, this is a service that is available for people who qualify for Medi-Cal. So that's something to keep in mind. It is income related or it could be based on a disability. So how you would find out if you qualify for Medi-Cal, you can contact the County of San Diego or 211. But in order to apply for in-home supportive services, you would contact the County of San Diego. Essentially, a social worker would need to assess your loved one's needs, and they would then authorize the number of caregiving hours that would be approved. So it's not something that you can say, you know, I want 20 hours of care for my loved one. They would come out and they would determine based on the criteria and their needs assessment what your loved one would be eligible for. And everybody gets a different amount of hours based on need. The family member piece is really important to note. If you are caring for your loved one and they do qualify for Medi-Cal, you could become their caregiver through this in-home supportive services process, and you could then in turn be getting paid for that help that you're already providing. So keep that in mind. If you were to do that, the public authority is who you would want to contact. They train all family members or outside caregivers through their process, and they would be the ones that would be responsible for you as the caregiver on that side. So those are the two entities that are kind of combining their services to provide this much needed service. So hopefully that helps a little bit, and I will provide the County of San Diego's contact information at the end. All right, I do want to briefly mention adult day health centers. So this is just another option. Again, if you're working and you're looking for a way for your loved one to have care during the day while you're not able to be there, they can go to an adult day health center and receive social activities and education, meals. It could also be physical therapy or medical care as well. So those are all great added benefits, and transportation is often offered to and from the location, so that might be helpful to prevent you from having to do that on your way into work or on your way home. But that's another option, and there are a variety throughout San Diego. Home delivered meals, I wanted to bring that up because obviously food is a top priority for everyone, especially right now. So home delivered meals could be a really good option. Not only does it promote good nutritional balance, but it also allows our loved ones to have a meal, whether it's a fresh meal or whether it's frozen, that they can heat up when needed. So it really just allows great benefit for our loved ones to have the food that they need to stay as healthy as possible. All right, we're going to move on to home health care. So as I mentioned, home care is non-medical. Home health care is the medical side of things. So it really provides assistance with skilled care needs or medical services at home. And this just gives a list of what is typically offered. That doesn't mean that everybody is able to receive the same service. It would be based on what the physician was ordering or what the home health agency determined was necessary. But it may include nursing care, whether that's wound care or medications or injections, could be IV antibiotics at home. Also different therapies, so physical therapy, occupational therapy, and speech therapy. So if your loved one has been discharged from a care facility, whether it's a skilled nursing facility or a hospital, they may have had a physical therapist come out and do at least an assessment of their home and how they're functioning to determine if they could benefit from ongoing support at home. Social workers are always also available through home health care, and that's something that I think is a great benefit because they can connect people to other resources as well. Often the discharge home from a hospital or a skilled nursing facility might feel like it's a lot. It could be overwhelming or it could be rushed. And so having that extra support once somebody does return home is a huge benefit. So how to access home health care. A person does need to be considered homebound in order to receive these services. A physician typically writes an order in order to have the insurance cover it. And again, it might be following a hospital stay or a rehab stay. It's most often paid for by Medicare or Medi-Cal or other health insurance plans. So if your loved one doesn't have straight Medicare, but they might have a different health plan, they probably have a home health benefit as well. All right, we're going to move into hospice care. So hospice care, what I want to stress here is that it really consists of a team of individuals who are providing support not only to a person who may have a terminal diagnosis, but it's also support for family members. And this is a service I think that we all can agree in the industry that it's often something that doesn't come into play until it's too late or until it's the last couple of weeks of somebody's life. And there are so many great benefits. So I can't tell you strongly enough that, and I encourage you to check out hospice care and to have those conversations with a physician or your loved ones or even a hospice care agency to find out if this could be an option for you and your loved one depending on what their situation is. So typically a physician would determine when an individual has 6 months or less to live. Obviously, they are just giving their best educated guess based on the current criteria that the person is dealing with, the current diagnosis, and the progression that may take place. I have seen that people have been on hospice care much longer than 6 months, so it really just depends on the situation. And of course, there are people who go on to hospice care who may only have a couple of weeks left. So the benefit is great, and I encourage you all to keep it in mind for future. So it is important to help with quality of life. And again, the support for family members who are caring for their loved one or trying to come up to speed on the changes that are taking place, the benefits can be great with that. They not only also help with the grieving process before somebody passes, but once your loved one passes, they offer that support afterwards, whether it's on an individual basis or it's a group setting. So that's something to keep in mind. I do also want to mention that if your loved one did pass away and they were not under hospice care, you can still access the grief support through hospice care agencies after the fact. So feel free to reach out to them. So again, it's a physician order. Medicare is who would pay for the services. They would cover the supplies, the medications, and all of those types of things that are associated with the diagnosis that the doctor determined would qualify the person for hospice care. So that's something to keep in mind. If your loved one has multiple diagnoses, not all medications may be covered. It may just be those that are associated with the admitting diagnosis. You are, of course, welcome to interview or meet with different hospice agencies, and keep in mind that care can be provided at home or in a facility. I do want to make note that hospice care does not automatically provide 24-hour care. Sometimes people think, well, once you go on hospice, you're going to have somebody at the bedside 24 hours a day. While that is part of their service, if it is deemed necessary, that's not something that is automatically started from day one. So it's important to ask your questions and have that information. Okay, so how to approach the conversation with your loved one. We know that, we all want to be independent for as long as possible. That is our goal. That's what we strive to do. And when we're having conversations with our loved ones, it's important to keep that in mind, that it's not an easy decision to allow help to come in. So having all of your information, kind of that research done ahead of time so that you can address it with your loved one when the time is right, is really helpful. So our recommendation would be to research, learn about your loved one's diagnosis or their chronic condition or what they're currently dealing with so that you can understand the progression. Is it something that is going to progress quickly, or is it something that over several years you're going to see different changes? Maybe you don't need to jump to having 24-hour care for your loved one if they've just been diagnosed with something, but you can talk about what that would look like down the road and making sure that your loved one is on board and understands the reason behind that. Of course, be empathetic, start the conversation early, but focus on supporting their independence. Listen and make sure that you are taking into account what they're saying, even if you're feeling like, I really disagree. Try and listen to them first before you go into making those calls, because it is helpful for them to be able to express their wishes and their feelings, and that ultimately will be a more successful outcome. And then moving forward, it would be involving them in the process, having them help to interview home care agencies or even hospice agencies. Those decisions are big, so allow your loved one to be part of that conversation so that they don't feel like it's being pushed on them, but that they are part of that decision-making process. And hopefully that will help out. Okay. So that was a lot of information, I realize, and I did want to keep it to a short period of time. I know everybody's Time is precious, and I want to be respectful of that. I do want to mention we have an upcoming webinar that is scheduled in partnership with Alzheimer's San Diego, and Amy Abrams will be speaking on long distance caregiving. So I encourage all of you to sign up for that webinar. The link is on our website, and I will be sending out information as well. And that one will take place in April, Tuesday, April 21st, starting at 11:30. So I mentioned at the beginning, obviously, we're in a difficult time right now. We're concerned about what the coronavirus means for our loved ones, for our clients, for ourselves, and for our family members. So I put together just this brief list of resources to hopefully help. We are being inundated with information. I know that the news is nonstop, and there are up-to-date resources that are here that I hope that you check out and can feel informed. Aging and Independent Services through the County of San Diego has sent out their website that they are keeping up-to-date information on, so I've included that here. Their phone number is the 1-800-339-4661. I encourage you to contact them should you have questions about in-home supportive services. If you're concerned about your loved ones or want to know about other resources, as well as adult protective services. I've also included California Department of Public Health website, Centers for Disease Control, and then I want to share a link, and I will send this with the recorded version as well. We are all dealing with this process in different ways, and there's a really helpful article that was put out that's about protecting your mental health during the coronavirus outbreak. This is something that I think is very valuable because their tips for how to handle it are things that are simple, and they're things that we can all do. So I hope you will take a look at that, and I will share the link again at the end of the webinar. But making sure that we're all knowing what's available, but knowing that we can't control everything. So thinking about those that we can control and what we can still do, even if we are confined to our homes in different ways than we used to be. And if you have any questions about resources right now, if you're looking for how to help your loved one get meals or different to reach out to us, and this is our contact information and our website. So if anybody has any questions, I will leave it open for that right now. But again, I hope that you stay healthy, stay safe, and that you and your families are okay during this time.